and no disclosure to make. I will focus on the four topics about the background of leadless pacemaker and the safety and efficacy, and also application progress in China, also cutting-edge technology and the future outlook of leadless pacemaker. The continual development of medical device techniques, more and more pacemaker, the size it becomes smaller and smaller, and there's a more physiological pacing the way. And in 1960s, the traditional transvenous single chamber pacemaker was approved. The pacing site at the is location at the apex of the right ventricle. And in 1980s, dual chamber pacemaker was approved, and also together with the rate response function. Later on, the cardiac resynchronization was also approved. It can help the patient with the heart failure, with the LBBB. And recently, the CSP conduction system pacing also come to the clinical application. Okay, and we all know that 1 in 8 patients might experience the complication with the conventional transvenous pacemakers. Leadless pacemaker have been shown to reduce pocket and related complication over 60%. Pocket infection is not so high, but the consequence was disaster. So the left terminal is the perforation, and should open heart to repair. The right is the pocket infection. This problem was more serious in the younger patient or patient with other comorbidities. So the first leadless pacemaker was nano-stim, which was recalled later, and the micro VR single chamber was approved in 2016, and the micro AV was approved in 2020. Later on, the dual chamber leadless pacemaker AVR-DR was approved in 2023. Now marketed leadless pacemaker was micro of Medtronic and AVR of Abbott. And the Empower of Boston Scientific is still in the IDE test, not launched yet. This is the performance comparison of the existing leadless pacemaker. We could see the AVR is the active fixated. The Empower and micro was passive fixated. And we could see the battery longevity varied significant according, depending on the mode and the pacing percentage and other parameters. It could reach from the 4 years to 16 years. Okay, how about the safety and efficacy of the single chamber leadless pacemaker? To date, more than 200,000 micro devices had been implanted globally, with a successful over 99%. The pre-market and post-market, also the real-world study and the data from Asia, all indicated the low risk of complication. These complications include the cardiac perforation, device dislocation, threshold elevation, and the vascular-related complications. These complications, compared to the traditional transvenous pacemaker, The device dislocation is relatively lower, but cardiac perforation might be a little higher and more severe, but it is still improving. As to the AVR, compared to the micro, the risk of the complication is similar in multiple studies. And after the progress to the stable the technique and the learning curve, I think the result it remain stable and to the favorable result. Okay, extraction also a problem we need to consider about. Do we extract every depleted leadless pacemaker, or we leave every depleted device there? We still do not have enough data. The successful rate of the nano-steam, okay, the previous one, removal over 5 years is about 90% because there's the longest removal period in reported case is about 9 years, and the fibrosis tissue adhesion after removal is not so obvious. The retrieval of AVR should be more easier than nano-steam according to its design. Okay, interestingly, it's also have the data about the micro extraction after the battery depletion. This is a single center retrieval and reimplantation of the micro. The average implantation duration was about 3 years, and the longest one is 9 years. The overall retrieval success rate was about 90%. No procedure-related adverse events occurred. But however, we do not recommend that every device should be extraction. We should consider about the patient situation. How about the application progress in China? It was the application of the micro in China already cover over 20,000 patients, over 700 hospitals of 31 provinces. As to the AVR, because it's the later entry to the market, and the global wide is like still lag behind the micro, but it's still booming. Since the last year it's launched in China already, AVR already implanted in China for more than 1,500. Okay, this is a 2 case of our center. The first one is 53 years old female with a normal body shape. She complained of the dizziness and the fatigue. Holter showed the occasional sinus arrest of 5 to 6 seconds. The echo is normal, and the other test is also in normal range. Our diagnosis is sick sinus syndrome with 1 degree AV block. Considering the expected long battery life and lower pacing percentage, and also safe the requirement for the safe retrieval, and possibly upgradable to dual chamber leadless pacemaker, we choose to the AVR VR to implant. The procedure is smooth, and the final image and below. And 1 day after the procedure, program report show excellent the parameter, and the parameter is stable for 6 months, about 6 months, and VP percentage is lower than 1%. Estimated longevity of the battery is over 20 years. Okay, the second case is about the macro. This is a senior male patient, 87 years old. The patient had diabetes for more than 30 years with chronic kidney disease on hemodialysis 3 times a week. The diagnosis is the intermittent third-degree AV block. Considering the high risk of infection, we decided to implant the micro AV. The post-operative image is satisfactory. Okay, now come to the cutting-edge technologies and the future outlook of the leadless pacemaker. The progress of the technique, more and more leadless pacemaker are emerging. For example, CRT leadless pacemaker, we could call it a wide CRT. We could implant a receiver to the left ventricle and communicated with the pulse generator. It could achieve almost the same effects did the traditional CRT. Also, physiological leadless pacemaker, there's a professor already talk about it. AVR VRCSP is still in the clinical trial. It's specially designed for the left bundle branch area pacing to restore cardiac synchrony. Also, there is a self-powered leadless pacemaker to make the longitude, better longitude and reduce the replacement. Also, the fully degradable leadless pacemaker for temporary pacing. I don't know when it come to can be launched. I don't know, but it's still a good idea. This is the leadless CSP AVR. Just now, there's a professor already introduced the technique. I hope it can help some people with, in certain conditions. Okay, this is the small summary. Compared with the traditional pacemaker, leadless pacemaker can reduce pocket and lead-related complications. And safety and efficacy of the single-chamber leadless pacemaker was proved to be by multiple studies. Still, I think AAI mode is very important, especially in those with sex synosis syndrome, but the conduction is good. So as we know, in SICD study, in the whole lifespan of the SICD, only about 2% advanced to the AV block to for the need of the support of the pacemaker. So it's not a high percent. So with emerging the more novel techniques and development, the field of the leadless pacing is growing rapidly. Maybe in the future, long battery life, conduction system pacing, and the micro formation may be the direction for the future. Of course, there's some problem to be solved, and is still challenging. For example, could we just put a like an AVR for AAI pacing? I think in certain scenario it's reasonable. Okay, that's all. Thank you for attention.